Hi, my name is Hedy Kindler. I'm a professor of medicine at the University of Chicago, and I'm delighted to be able to speak to you today at ASCO about the results of the POLO trial. Pancreatic cancer, as you know, is a dismal disease. Most patients with metastatic disease, even with contemporary chemotherapy regimens, will live less than a year. We know that patients with pancreatic cancer, about 4 to 7% of them, will have germline mutations in BRCA1 or 2. Olaparib is a PARP inhibitor that is approved for ovarian cancer and breast cancer, and in a phase 2 trial in pancreatic cancer patients demonstrated some activity. So we decided to perform a randomized trial to validate this activity in germline BRCA mutated pancreatic cancer. Patients were required to have received at least 4 months of platinum-based chemotherapy without progression. There was no maximum duration of that chemotherapy. Those patients with stable or responding disease were then randomized to either olaparib or placebo. What we observed was a clinically meaningful, statistically significant improvement in progression-free survival from 3.8 months for placebo to 7.4 months for those patients who received olaparib. That's a hazard ratio of 0.53. In other words, we saw a 47% decrease in the risk of progression or death. From 6 months onwards, more than twice the number of patients on olaparib were progression-free compared to those on placebo. And what is truly remarkable is that of the about 23% of patients who responded with partial or complete responses, the median duration of response in these patients with metastatic pancreatic cancer was more than 2 years. Health-related quality of life was maintained with olaparib, and the toxicities were no different than what we observed in other tumor types with this drug. So in conclusion, we observed that maintenance olaparib provided a clinically meaningful, statistically significant improvement in progression-free survival in those patients who have stable or responding disease and a germline BRCA mutation. So we believe that maintenance olaparib after systemic chemotherapy with a platinum should become a standard of care treatment for these patients. And these results really highlight the need for germline testing at diagnosis in this population of patients. Thank you.